Can't tell if they're ready. Okay, good. Good morning. Welcome to the new year, 2022. I have your attention. Goody. We have two commissioners on Zoom, Commissioner Scholl and Commissioner Fisher. And Shannon, I assume that they'll just let us know when they need to make a comment. Welcome to the Clackamas County Board of Commissioners County Administrator Updates and Issues for January 4, 2022. Gary, take it off, please.
Thank you, Chair Smith. We will start with Metropolitan Exposition and Recreation Commission update. John Erickson is the Clackamas County representative on the MERC, and he's here to give a brief presentation on the work of the MERC. Welcome, John. Thank you.
Do I have to do anything here?
Oh, it's on. Go ahead.
Okay, fair enough. Thanks for the opportunity to bring you up to date on MERC. I don't know how many of you are fully aware of what MERC is, but I want to make sure that we inform everybody that we can. The three facilities we have oversight of are the Oregon Convention Center, the 5 live theater venues within Portland, and the Expo Center. So I know many people think we also oversee the zoo. We do not. That is separate. These are the largest group meetings and performance centers in Oregon. The commissioners serve the Metro Council after being recommended by their representative areas. So I represent Clackamas County as the individual representing Clackamas County, and I appreciate the support. The most important thing that we do is to make sure that the financial integrity of the venues are maintained. To do that, we do have the financial responsibility to approve budgets, to set rates, and to set policies for the venues. So it is important that we have a representative from Clackamas County as well as from the hospitality industry. Unfortunately, I'm the only one from the industry that is on the commission. Many of the other people are lawyers, general residents, we have business people, and a CPA. And Stoudemire Phillips is the Metro representative and is chair of the commission. I'm vice chair at this time, and Deidre Kristoff is the secretary, who is also a CPA. So we have good representation. Kara Stoudemire is a vice president with a insurance company, Moda. We have challenges that have been addressed in the last 2 years. Just so you know, the biggest producers of business revenue, of course, are conventions, trade shows, live theater performances, and individual corporate meetings. All of these have been basically reduced to near zero over the last 2 years. So we've had to rely on most of the revenue that is set aside for operations, but we reduced all of our staff over the last 2 years down to next to nothing. They're now just starting to come back, and we were seeing some very good bookings start to come back. Unfortunately, with Omicron, we're seeing some challenges again. Some of the live theaters are being canceled. Some of the trade shows have been moved to later in the year or to next year. And conventions that were set for this year. And we have had some that are still staying with us, but they are starting to move also into next year and the year after. The problem with conventions is they book multiple years in advance, so we have to get back into that pattern. Most of the financial information is presented in the presentation, or there's links there. I don't want to go into all the detail because there's a lot of information. But it is available for everybody to link into and get some information. Some of the things we've done over the last couple of years is serve as a major vaccination site. We've, at Expo Center, made sure that we can do multiple testing. We've served as a fire resource center because of the fires all over the region. And there's a lot of different things that have been going on at the convention center. There's additional links in this presentation that you can see. We have served as a resource for Metro and for the management of the venues to bounce a lot of ideas off of, to generate a lot of input on what is happening within our communities. And the venues are responsible for operations. We set policy and approve contracts and everything else. We do not get involved in day-to-day operations. So we've been active. We've been very cognizant of what needs to be done to support our businesses. Hospitality, as we all know, is one of the largest industries within the state, and it's a major part, including restaurants and hotels and destination locations that benefit Clackamas County. We're working hard to ensure that we get as much business back to these venues to act as the support and generator for our businesses in the next 2 to 3 years. We don't see a major return to what we were doing, which was extraordinary income 2 years ago. We don't see that returning until about 25. So we're slowly building up. It all depends on what happens with travel, with conventions, and trade shows. That's the bulk of my presentation.
Thank you, John. It's really disconcerting that you don't see a return until 2025. At the Expo Center and the Oregon Convention Center, for instance, you say their conventions have been postponed to another date. My question is, are they leaving the Portland area altogether for other venues that are open that have different COVID policies within their state? Do you know that for sure?
The information that we receive back from the meeting planners and everything else is, it's across the country and across the board. It's not because of our policies. It's because of travel in general, individuals' concerns wherever they go. Conventions are being canceled throughout the entire nation. My son lives in Las Vegas.
Yes?
They've lost 82% of their conventions.
That was a big convention city.
Yeah.
Yes.
So we're not the only one.
Okay. Well, that's good to know. I understand we're open for business, but we're also handcuffed at the same time.
Right. We're trying to control everything we can until we
You know,
can
I'm
get
looking,
back to it.
for instance, at your income at the Oregon Convention Center, and the last year's budget, the 2020 budget, you came in at 19 million. No, excuse me. I'm reading this wrong. Your revenue was 6.7 million.
That's it.
For 2020, you don't have a 2021 figure on here. You jumped to 2022.
Right. 22 is a budget, 23 is a budget, 21 is just being finalized.
It's just being finalized. So when you get that finalized, would you send that over to us?
Yeah, we'll send the whole line to you.
So we have a comparable. Just off the cuff, what do you think that the 2021 revenue looks like in comparison to 2022? Just off the cuff, comparable, less, more?
Less.
Less, okay. So it would be less than the 6.7 million. I'm just curious
Right.
about what's happening overall.
It's been a challenge.
Commissioner Savas.
Yeah, I appreciate the opportunity here. It's in the packet here. It shows that there's three identified venues.
Right.
And I'm just curious to why, for example, the hotel itself, the new hotel, and PIR are not two more of those venues.
We don't have responsibility for those.
I understand that.
Yes,
Yeah.
the Hyatt itself is an entity unto itself, and they have no responsibility to us. They work with us, just like all the hotels do. PIR is totally separate, it's not a meetings venue, so it is a separate entity. We have no oversight or right or responsibility to set any policy or rates out there.
So are these are,
These are the only three that we
yeah,
oversee.
I see that, okay. I just was curious as to why maybe perhaps those weren't considered being part of tourism, being part of the whole system, right? I mean, it's,
Yeah,
there's some gaps there.
Yeah, I wish I could answer that, but it is set within code on what our oversight is, and the code is there.
Thank you. Any other comments or questions for the presenter from the commissioners? I'm hearing none from our folks on Zoom. John, thank you for coming forward. I appreciate your service to Clackamas County and representing the overall tourism needs of the region.
Thank you.
You bet. Gary, what's up
Thank you.
next?
And next is, Commissioners, for you to appoint the current vacancy in the county's seat on the Metropolitan Exposition and Recreation Commission. Emily Klepper from County Administration has been leading this recruitment process, and she will give an update. Welcome, Emily.
Morning, Commissioners. I've actually been coordinating quite closely with PGA, so we went back out at your direction to put this recruitment together. The recruitment closed December 31st with only one applicant, which was John Erickson, who was just before you, which would be my recommendation for you.
Thank you. Thank you. I appreciate staff trying to open it up to our citizens of Clackamas County, but we've only had one applicant, and that is the current seat holder. John, thank you for your willingness to continue to serve. I will, at this point, entertain a motion for his appointment.
Move for approval.
I'll second.
Commissioner Savas has moved for the approval of John Erickson for our Merck representative, and Commissioner Schrader has seconded that motion. Do we have any other comments from commissioners at this time? Seeing none, Shannon, would you please take the poll?
Commissioner Scholl?
Aye.
Commissioner Fisher?
Aye.
Commissioner Schrader?
Aye.
Commissioner Savas?
Aye.
Chair Smith?
Aye, motion passes 5-0. Congratulations to John Erickson. Don't be a stranger. Come back. Let us know what you're doing. Let us know what the wonderful things and the progress we hope to make in the future. Thank you, Emily Klepper, for coming forward.
Yes, I will prepare the paperwork and send that over to Metro for you.
Great.
Thank you.
Thanks for your interest, John.
Adios. Gary.
Thank you. Next, Hoodland Park District petition update. Jeff Munns from the County Council's office. This is on your agenda already for this Thursday, a public hearing. This is just kind of to prep you, brief you, get you ready for that public hearing. Go ahead, Jeff.
Yes, thank you, and good morning. As I know you're aware, we have this Hoodland Park District petition. It's been filed. It was filed with the clerk's office in November, and they certified the signatures about a week and a half after that, and so it's now before you for a required public meeting. This process is heavily controlled by statute, ORS Chapter 198, and so the public hearing is one for you to consider the petition and the criteria that's set forth in 199-462, which is really the heart of what you'll be doing in this. So some background is that this Hoodland Park District will be established under ORS Chapter 266 as an independent Parks and Recreation District. It roughly follows the outline of the Hoodland Fire District. It's centered in the Welches area. Primarily concerns property that we have had as a MOU, Memorandum of Understanding, with the Hoodland Women's Club for quite some time. Attached to the materials are the most recent MOU and an extension or an amendment of that. It includes the former Dorman Center location in Welches, and then two parcels close to that, one they refer to as the Water Tower parcel and the Hunchback Strip parcel. And so as part of this MOU that we've had for a number of years, the county has continued to maintain these sites and has said in there that if a Parks District were incorporated in the area, that those would be potentially transferred to them. So that's been something that's cited in the petition as well as in this past MOU that has been handled by BCS over a number of years, I think dating back to 2012. So it brings us to where we are today. The petition has been filed, signature is certified. There's been quite a bit of public interest in this process as we continue to get emails from citizens and different groups in the area about the process and how it works. And so this public hearing you will hold is unique in a sense that your decision is limited to the criteria laid out in statute, but you can adjourn this hearing for up to 4 weeks. So you could start the hearing this coming Thursday, and then if you have a great deal of public interest, continue it to another day, and you can do so for up to 4 weeks from the date that it is first started, to give you time to hear from the public and different organizations that are interested. But the criteria that you're to evaluate really focus on what's in our comprehensive plan. The outline is you're to consider any local comprehensive planning for the area, the economic, demographic, and sociological trends and projections pertinent to the proposal, and past and future physical development of the land directly or indirectly affected by the district, and the statewide goals. So in the materials I provided are a copy of a statewide Goal 8 regarding recreational needs, and that is then tied to our comprehensive plan, chapters 9, which is for open space and parks and historic sites, and then chapter 10, which is the Mount Hood area comprehensive plan. There's nothing that I see in this that is in conflict with the petition, but those are the criteria for you to look at. And in particular, in the comprehensive plan, chapter 9, 9A3 refers to protecting open space resources outside of the urban growth boundary, and then 9B9 is to coordinate county activities with other agencies and organizations to provide park and recreation facilities. And then I included all of the information regarding the Mount Hood area and the maps and so on as part of the comprehensive plan, as those are referenced by the statute. So the statute that you'll be following as part of your decision really limits your decisions to those, but you're able to hear any testimony for your consideration that touches on that topic. The board's authority can accept the petition. You may also modify the petition as far as including additional land or taking land out of the proposed area if it's in conflict or is shown to be necessary for the district to be cohesive under those criteria. And if it's approved, then it would be set for a vote on May 17th of '22, because there is a permanent rate associated with this district of up to 67 cents per thousand. I think according to the petition, they projected their economic feasibility study on 57 cents per thousand, but they have asked for authority up to 67 cents, according to what they submitted. So with that, then they would have authority to go up to that, but what they're basing their calculations on so far is that lower amount.
The lower amount of how much?
57 cents per thousand.
57 and not 67.
Correct.
Have you finished?
That is all I had at this point.
Now, the reason why we're considering this now, is it correct, the petition, since the petition has been filed, we have 50 days, according to law, to have hearings and send it to the voters for a vote, correct?
Correct. The first setting of the hearing has to be between 30 and 50 days after when the petition is filed and given scheduling. Thursday will be the 49th day. So we need to start the
This
hearing.
Thursday will be the 49th day?
Correct.
Okay, so I would recommend, Board, that we do have that hearing and possibly have a second hearing that gives the residents in the area and the property owners an opportunity to weigh in on this. Commissioner Schrader, you have your card up.
Yeah, and Jeff, we don't have a link with the information that you probably sent it via email.
I did send it via email, and I
Okay.
just talked to Shannon about getting it updated. It's also in the business meeting packet.
Okay.
It's pages 10 through 103 in the business meeting packet.
Okay.
So if you have any questions, feel free to email me, and I can send you another
I can
copy
do
of it.
that. Usually, though, if we can get links with this, it helps, but.
That was my
it's-
fault, Commissioners, because it's in your business meeting packet, I did not include it on the issues list.
Oh.
That's my fault. I didn't
Well,
do that.
no, it's not your fault. I should be reading the business meeting packet, so let's just
Thank you,
be,
Commissioner. Thank you.
let's just be honest about that, Gary.
Well, no, I think this is a hybrid situation that all of a
It
sudden we're
helps.
considering this because we're at 49 days.
Right.
Yes, okay. Commissioner
But no,
Sa-
I have a little
Yeah,
bit
go
more.
ahead.
So again, is this including government camp still and part of Meadows? The
Yes.
geography of it?
Yeah, if
Because
you-
there's been pushback from those two areas.
We've had
Yeah.
quite a bit of public interest from all the different areas involved.
Okay.
But yes, it extends from the Brightwood area through Welch's up to government camp, and then a little bit beyond government camp to some of the other development up there for the communities on the mountain that the petitioners believe would be benefited by this recreation district.
Right. So there has been pushback with that, and our job is to, I just want to make it clear for some of the folks with pushback. As a commissioner, I remain neutral. I've always been a proponent of parks. It doesn't mean that I'm saying yea or nay to this proposal. However, I will say the Hoodland Women's Club has worked very hard over the years to push this forward, but I've also heard through various channels that they felt as if they weren't communicated with, and they were getting anxious over the timing of why they didn't hear this was moving forward. And so I just want to say it was moving forward, and that my strong suggestion is if they feel something isn't moving forward, they need to contact us directly so they can get a direct answer and not put it through other channels, because that's a courtesy to us as a commission as well. So, so it's been timely, am I correct? I mean, we've been working on this, and how long have we had it?
Well,
Under
they
our
filed it on the last day, which was November 18th.
Okay.
They had filed their prospective petition, when did they file that? I believe it was in October 22nd was when their prospective petition was filed, and they collected all of their signatures between those dates, October 22nd and November 18th.
Okay,
So they were able to obtain, I think, almost 1,000 signatures, 900 and some were certified, and 800 and some were required. It's all in it's Exhibit 2 to the packet when you take a look at
Yeah.
it from the clerk's office.
yeah, I just want to assure the people that were up there, they felt they weren't being listened to, that indeed it was just going through a normal and very timely process. There was no reason for us to
We're
not
pretty
move this
restricted on the
forward.
timelines as we move forward as well with this,
Yeah.
obviously, so.
Okay, I just want to get that on the record so they're aware of it. So, thank you.
Thank you. Commissioner Savas?
Yeah, well, some of you know that I've got a long history with districts, and, in this case, we're abiding by a citizen-led petition, so we have responsibilities to do what we're doing. I totally understand that. We didn't initiate this petition. It was initiated again by the
Right.
citizens. However, actions we took and purposes we took have led to the citizens taking action, and that being the property are
Right.
trying to get that off of our books as a cost and so forth and responsibility, which is actually a very similar thing as to the rationale for the creation of the library district and CPRD and so forth. It takes a burden away from the county. However, this being different, this is not a county service district. This will be a parks district. But my question is, in this unique circumstance, what responsibility do we have to, as county commissioners in this citizen-led petition, to assure the voters or the residents within the boundaries that, number one, it's equitable, they're going to get, what's in the ballot message, the content, the delivery, what the intent, purpose, benefit, you mentioned the tax rate, so I got the 57 up to 67 cents. But I'm just kind of, what can we do to assure the voters, frankly, that between now and then, of the content and the purpose and the mission? Or is that simply out of our hands?
Well, I think this is really a process for this commission. This isn't something where the petition was brought to us, wasn't started at the county, and so you're providing a forum for this information to be heard and for you to apply this criteria. So I tried to include all the criteria referenced by the statute in your material, so you'll have that to take a look at. And that can be a resource for anything additional that's a part of that you'd like to have. And then provide that forum for you to hear the information from the citizens and the petitioners on this process. But this board's role is really limited to conducting the public hearing, receiving the information and applying their criteria, and then making the decision as to whether or not to accept, modify, or reject that petition.
Okay, let me reframe it again. And I think what I'm hearing is very limited input as to how anything's crafted, right? Or any deliverables. And what I mean by deliverables, for example, if this, within the boundaries of the proposed district, if the benefit is in a particular section of those boundaries, proposed boundaries, but there's other areas that are farther away that won't realize a benefit, and yet they'll be taxed for that, do we have any ability to put in some assurances that there will be a benefit, or just subtract? We have the ability to subtract that land, as you told us, that territory, but it seems to me that there's a fundamental question, is that someone gets taxed, I don't care if it's a penny, 1,000, what did they get for that? What do they get for that? So what controls do we have aside from what you've already stated?
Sure, I think you have to base your decision upon, one, the petition that is actually presented. In this petition, they talk about their future projects that they plan to have as part of the petition. Now, those decisions, though, will be made by an independent board, not this Board of Commissioners. It's a special district, it's a Parks and Recreation district, so it would have its own board to control those decisions. But as to what's been presented to, in this petition for review, you would take a look at, again, in the criteria, the comprehensive planning, how it aligns with that, economic, demographic, sociological projections, and past and future physical development. Those are the criteria you look at. And if the public or petitioners come in and they can present information that helps you with that decision, that's what you would use in forming your decision about whether to accept, modify, or reject a proposal. So in your example of property that is further away from the center of where these lands are, is there something else in this petition that shows that they are then providing a service? I know there's some reference to trails in here and working with other agencies in the area to enhance existing recreation or add new recreation. So those are types of things that are in their petition that you could talk to members of the public or the petitioners about when they come to testify before you in the public hearing.
Yeah, so I'll close with this, and that is that, and if you can respond, that's great. So, we have often heard on formation of districts, what was in the ballot measure, everything seems to go back to the intent. That shows the intent, and perhaps even spelled out sometimes are deliverables in there. So our discretion to craft anything in the language is there discretion to craft or add content in there? Or simply is our discretion only to subtract land?
No, you can, the statute allows you to modify this. Part of that is subtracting and adding areas to be served, but also I think when this matter is placed on the ballot, it's to be accurately reflect what this district would do. And we can talk more about that as we're forming the language and the order that would be considered by this board. The specifics of that are hard to answer at this point until we've received additional information from the public. But from what's in the petition right now, that's sort of the starting point. Then we work from there.
Okay. I'll speak more about this on Thursday, but that's where I'm going with this.
Yeah, thank you, Paul. You
what
bring
discussion we're
some
gonna have.
really relevant points. I'm going to encourage all 5 commissioners to go through and read that petition carefully in preparation for the hearing on Thursday, to have ideas in your head on this. But keep in mind, we will have a second hearing we will notice it and invite the taxpayers and the public who are affected by the formation of this park districts to come forward at another public hearing and give us their input and/or invite emails and written suggestions as well, so we can consider what we need to consider on this, and keeping all represented areas in mind in this, because we are creating something new here, and it needs to have careful thought and consideration. Any other comments from anybody on this?
I believe thanks you for the apology. It should have been in the packet. If it's presented here on Tuesday, the material should be in the packet on Tuesday.
I think that point was made, Commissioner Savas. Thank you very much.
All right, thank you.
You bet. Up
Thank
next,
you.
Gary.
Next, Public Health Omicron response. And Chair, I would ask that you convene as the Board of Public Health for this item, please.
Thank you. I will now adjourn as the Board of County Commissioners and convene as the Board of Public Health.
Philip Mason Joyner, County Public Health Director, go ahead.
Good Good morning, Chair Smith and Commissioners. Nice to meet with you this morning as the Board of Health. So I wanted to provide an update to the board in terms of what we're seeing related to COVID-19 and Omicron. In Clackamas County, over the past week, we have seen the largest increase in COVID-19 cases since the start of the pandemic. We had 1,419 cases the past week. Compared to 2 weeks ago, Clackamas County had 460 cases, and last week we have 682. So, oops, sorry about that. There we go. Can you hear me?
Mhm.
Should I repeat that, or
No,
are we
keep
okay?
going.
Okay. So we are seeing significant community spread with this variant. The trend is happening nationally and statewide. It is good to see that majority of cases are fairly mild. The hospitals are busy. Healthcare is busy in general, treating sick people in the community. COVID-19 hospitalizations are still pretty low. Our death data remains flat right now, so that's good. We have to get through this right now in terms of the high case counts, and certainly seeing the impacts of the holiday season and folks getting tested and needing care. And in public health, we're really needing to shift how we respond to this new variant in the community. Some of the things that we've been working on in public health, and I'm here today to discuss these decisions, to get input from the board, your feedback, any concerns you have, so that we can pivot based on any concerns. But we do see the need to increase capacity at our local vaccine clinics, and specifically our mobile teams. We have full booster clinic appointments. We have more populations becoming eligible. We have mobile teams that are serving long-term care, adult foster home, other homebound folks, with schedules out until February. I really see the need that we need to increase capacity within our vaccine efforts so they can get access for the folks who want the vaccine more quickly and don't have to wait. The fastest way for us to be able to do that is to shift some of our contact tracing staff. Our existing employees are contracted staff that we have in public health, currently doing a lot of phone interviews, remote work, providing consultation and interviews for every case that tests positive for COVID-19, providing with that guidance, doing those disease investigations. With 1,400 cases in 1 week, it is just not possible that we can call every single individual who tests positive and provides them with guidance. I feel that's really important that we have some staff available to provide consultation, technical assistance for schools, for long-term care facilities, for other high-risk, vulnerable community members, for individuals who want to call us. So it's more of a reactive approach where we're relying on folks to contact public health that will be available to provide that consultation. But what we really need to do is proactively communicate to the public about what they need to do, continue to reinforce those key messages. If you test positive, if you are sick, what you need to do, current CDC and OHA guidelines for isolation and quarantine, we need to share that information and not expect that every community member is going to receive a phone call from public health in a timely manner.
So basically what you're saying, if you're sick, stay home and take care of yourself,
Correct.
correct?
Correct.
And that is something I think is really hard for our society to do.
And notify individuals that you've been in close contact with.
And you're in close contact with individuals. And two, I think we're asking, Philip, the personal responsibility that each person holds in taking care of themselves and their unit, their family unit or their friend unit, and reaching out for that. And going back to, I can't emphasize enough, going back to the personal care responsibility that we have. If you have a cough, cover your cough. If you have a sore throat, you probably want to stay home and get treatment for that. Hand washing, keeping your spaces clean, disinfecting. All of those actions are really, really important. And as you say, this particular variant has spread, but not necessarily has hospitalizations increased because of Omicron. Is that correct?
Currently, that's correct. We're seeing a slight uptick. We'll be monitoring that, sharing that on Thursday. I'll I'll bring that hospital data back for the board every week to look
And I
at it.
don't want to diminish hospitalizations, because I believe our hospitals are fairly stressed out because of a labor shortage caused by whatever reason. And so to say that our hospitals aren't seeing a lot of workload, it's probably from other areas of our health system as well, just not Omicron. And then, Philip, you sent an email to the board, and you had 3 requests in there. Do you want to address those now, or do you want to open up to discussion?
Sure, I touched on the first 2, so increasing capacity at our clinics, shifting the contact tracing efforts to focus more on vaccines, to reassign some staff to help lift those efforts. And then we're right now in active discussion with the Oregon Health Authority around what's called school exclusion. So that's a process annually that we work with all of the 150 schools in Clackamas County. We reviewed the required childhood immunizations that students are required to have in order to attend school in person. And we reviewed those records with the schools and with families. And for any students who are not up to date on their immunizations or have a medical exemption, they're required to be excluded from school. That date's in February. I'm very concerned about that date. We know that children have been disrupted with school, not being able to attend in person. That date's quickly coming. I'm concerned about families having access to get up to date and appointments to get those vaccines, to get caught up. So we are asking for the Oregon Health Authority to extend that from February to later in the spring, later this academic year. I think that's
Okay.
really important, and that could be an area that the board could assist us.
I personally think your requests need to be considered, but we have a couple commissioners with their hands up. I believe Commissioner Schrader, you are first, and then Commissioner Fisher, you're up second.
So my question is about testing.
How accurate home tests in general are pretty accurate if you do them. And I can speak to this more on Thursday, but, doing one and being negative, if you're asymptomatic, you can feel pretty confident. If you have symptoms, doing them, at day 3, at day 5, that's helpful. And if you do have a positive test, you can be pretty confident that you have tested positive.
Okay, but they are accurate.
Yes.
Okay.
And they are becoming more available. The state of Oregon has ordered 12 million at-home tests that are being delivered to the state's warehouse in Wilsonville. The first shipment tomorrow. Those will be distributed to healthcare providers, to schools, to public health, to distribute to the community. Testing right now, there's so much demand. There's demand for boosters, there's demand for testing. Those are the top 2 pieces of demand. Testing sites are really full. Trying to get into a primary care clinic or get into an urgent care clinic to get a test right now, you have to wait a couple days. So if you don't feel well, stay home.
That's right, it's the
And
best.
try your best to get a test, but don't wait until you get that test result before you decide to start staying home. If you don't feel well, you need to stay home.
Okay, but I guess my question is then, is the PCR test much more accurate?
That is the gold standard test, yes.
It is. Okay, thank you.
Philip, you alluded to home testing, is that correct?
Yes.
Okay. So how much are those? Are they free?
The shipment coming in from the state of Oregon will be free. Now, if you want to try to buy one at a pharmacy, and right now stocks are pretty empty, but they're about $30 for a pack of 2.
But they will be free?
Vast majority will be free.
Okay, and then you can pick them up at any pharmacy, correct, if they want to?
The ones at the pharmacy are $30.
Okay. What about the free
the ones
tests?
that we're
How will they be
distributing?
distributed?
It'll be distributed through healthcare providers, through the schools, and through public health, and more information to come. We'll work with PGA to communicate that out to the public about how folks can access them.
Thank you. And yeah, please get that message out when we know what's going on with that. Commissioner Fisher, you're up.
Yeah, thank you. Philip, before we talk more about the policies, I'm glad that I get to ask a couple questions. You say that the Omicron people with it are not as sick, but how sick are people? Like, is it like a bad flu? Do they just say that people aren't that sick because they aren't going to the hospital? Or, I mean, what does that mean? Do we know?
With this variant, we're not seeing as much severe illness as we did with the past variant, the Delta variant. So we're seeing folks with headache, fatigue, sore throat. Those are sort of the classic symptoms with Omicron. And some folks are, asymptomatic or mildly ill. So it is,
Okay,
for
so
the vast
basically-
majority of people, it's a lot more mild of an illness. But of course, there are folks who are higher risk, who are vulnerable. We're not out of the woods here. I don't want to downplay it at all. There's still significant risk with this virus spreading that a small percentage of folks can and will end up in the hospital.
Yeah, I'm just trying to get a sense of the big picture, like of how disruptive this is to workforce, to economy. If people are able to, if they just feel like they have a bad cold, they're still able to work, even though they may be working from home. I'm just wanting to get an overall picture of how sick our community is going to be.
I think we're seeing there are quite a bit of folks that are sick this week in our community and nationally. It does have an impact on the ability for schools and businesses and employers to be able to operate, because folks are calling in sick. Your continuity operations are going to be challenged. So it's certainly for every employer. This is going to be tough to get through this surge, and it's just starting.
Okay, so then you're saying that people are so sick they can't really work or be functional, is what you're telling me, for the most part, with Omicron.
Well, I think for a lot of folks who have the luxury to be able to work remotely, a lot of folks will be able to do that and get through their isolation period. A lot of our community members don't have that luxury to be able to do a job that allows them to work remotely.
Right. I'm just trying to get a sense of how debilitating it is, because there's a big difference between a bad cold or a flu, as far as how people feel and how they're able to work or how they're able to think and function and do those things. So that was my first questions. And my second question is, across the country and in South Africa and other places where there is more information about Omicron, because it's happened sooner, I am hearing in the media, but you never know what the media says, if they're just blowing things up or not, but that hospitalizations are increasing, especially for children. Is that a trend that is actually true, and do we expect to see that here as Omicron takes hold?
I don't expect to see childhood hospitalizations to increase here, but we'll be monitoring it really closely. I guess is the best way I can answer that, Commissioner.
Okay, so what about the first part of my questions, as far as hospitalizations rising across the country? Is that true, and do we expect to see that here?
I'm seeing a slight uptick. We're a little over 300 COVID-related hospitalizations, so it has increased a little bit. I'm hopeful, like South Africa, where we saw a big increase in cases, and it didn't have a huge, severe impact on hospitalizations. I'm hoping that plays out here too, but we're going to have to monitor it week to week.
Okay, thank you.
I have a follow-up to Commissioner Fisher, and then Commissioner Savas, you're up. You say hospitalizations, people with COVID. Are they in the hospital for a reason, and then it's discovered they are in the hospital with COVID, as opposed to being in the hospital from COVID? Are you able to differentiate those numbers going forward, or is the Oregon Health Authority able to differentiate people in the hospital with COVID because maybe they have a heart, maybe they broke their leg, or from COVID?
Yeah, I think it's both. I will see if we can drill down to look at that comparison, but I think when you hear those numbers, it's both of those situations at play there.
Yeah, thank you very much. Commissioner Savas, you're up.
Early on, Philip, you talked about the death rate, use the word rate, which usually is a percentage, and it sounds to me like the numbers are...
Commissioner Savas, is your microphone on? There you go.
Not. So it sounds like the way the OHA reports the deaths, it's a daily count, let's say, or a count. It's not a percentage or a rate. And knowing that there's been just what, fivefold, sixfold increase lately in the numbers of people with COVID, and the death rate actually declining, actually in the last 30 days declining, and as you say, flat, the number. The actual death rate for Omicron, or whatever's out there in Oregon here today, which we don't know, seems to be substantially lower, that rate. And so how do we discern in Oregon right now, today, tomorrow, how many people are infected? Is that a reflection that it's more Omicron? Because how does one determine if they got Delta, they got COVID, but yes, got COVID, I tested positive. How do they know if it's Omicron or Delta? And it seems to me it'd be appropriate at some point, if we have adequate hospital capacity, to look at some practical means and thinking that the rate of acceleration, perhaps it's not that alarming if the death rate is not climbing, which means the death rate's not climbing, it's substantially lower. The death count is flat, not climbing. So it seems to me that we ought to be factoring that in our precautions going forward.
Yeah, I think you have to look at all of those factors. Case rates alone don't tell the story. I am concerned, though, if case rates get so high, you're still going to have a small portion of folks who will die as a result. A small percentage. It's a small number, so we don't need to get alarmed, but it's still, these are individual community members, family members, friends, colleagues that, are going to be impacted. So I understand what you're saying. It's something we're monitoring. I'm concerned about it, but I'm not, so that's why I think these three recommendations at this point are really the appropriate actions for us to take.
Is there a means of determining how many cases today are Delta and how many cases are Omicron?
I look at the modeling and I look at the state sequencing. It shows Delta's coming down, Omicron going up. They only sequence a portion of all the samples, the test samples. There's a lot of confidence across the country that Omicron is on the rise and Delta's coming down, so that is how we're operating. If we see this week someone with severe illness that is really struggling with COVID, it's quite possible that that's the Delta variant that's still in our community. It's not completely gone away. I think it's going to fizzle out as we move along and Omicron becomes the dominant strain.
If someone passes away from COVID, is that determined as to what variant they have?
Not necessarily.
Not necessarily.
Not necessarily.
Seems to me to be
all the samples.
I've always believed, and I still believe today, that having the lowest hospital capacity in the nation, Oregon being near the bottom, that the hospitalization factor is one of the key metric for us to make sure, precautionary wise, that we're being careful. But I think it's important that we somehow determine. I think people themselves would wonder, if I got COVID, which one do I have?
Yep.
Right? I mean, people are going to have that insecurity. So people might choose to go to the hospital only because of the worry.
Mm-hmm.
And I just tell you, a family member of mine is concerned about that right now.
Yep.
Which one do I have? They don't know.
Thank you, Paul. You finished?
Yeah.
So, Philip, what are we doing to try to keep people out of the hospital who have COVID?
I think the beginning is, of course, focusing on prevention. Prevention of getting the disease in the first place is really critical.
Yep.
We have worked to make some new treatments available to treat folks. Our health centers here at Clackamas County has really been a leader in that space, providing things like monoclonal antibody treatment. I think the pill that is coming out, that was recently approved, we've been talking to OHA and hearing from the CDC about the plan for that distribution. That's still in process, but once that comes, I think that tool will be really effective in helping us assure that folks don't get severely ill from this.
Mm-hmm.
So I feel like there's work happening. There's work happening to try to reduce.
So it's quite encouraging. So the FDA has approved a treatment for COVID that is quite effective from what I understand, but delivery to the state of Oregon isn't here yet.
Right.
In my conversations with my other two counties last night, that was the main consensus. So I am encouraged by that. I'm also I can't say enough how important self-care and homeopathic remedies available do work in some cases. Now, are you familiar with Dr. Peter Graver? He's the data statistician at Oregon Health, at the OHA. And whereas we've seen a huge spike in the last week, you said, of 1,419 cases, the downside of that, he has predicted that it will fall as dramatically as it went up. And do we have a timeline on that?
February?
Yeah, just bring
Roughly.
it Thursday, because I think
Okay.
that, it's the law of physics, really. Something goes up so fast, it's bound to drop as fast. And I believe a lot of these news reports we hear in the media are statistics based on December 30th, 31st, and a week has since passed where, of course, people were communing at Christmas with family and friends and at restaurants and gatherings. And so, of course, the case count's going to go up. I think that is so predictable. I also think it's rather predictable that the case counts will fall as dramatically. But for the next couple weeks, maybe you can bring us a timeline moving forward on that for Thursday, what we're looking at. And any other comments? Philip, I want to thank you for your service, and you've always done due diligence, and you've always been really up to date with your information, and I really want to thank you for that.
Thank you very much.
Gary?
All right, thank you, Philip. If you could please now reconvene as the Board of Commissioners. Chair.
Yes, I can. I will now adjourn as the Board of Public Health and reconvene as the Board of County Commissioners. Gary?
Thank you, Chair. With your permission, Chair, I'd like to move to the consent agenda because we need to get through those today, and we're running out of time. So is that okay, Chair Smith?
Yes, go ahead.
Okay, we'll start with elected officials, Clackamas County Sheriff's Office. I don't see anyone here, but you did talk about this in December before your recess board, and that is approval of a board order for the purchase of body cameras, tasers, associated accessories and software services, and training from Axon Enterprise through a cooperative contract. Total contract value is $2,664,717 funded through the Sheriff's Office Public Safety Levy. No county general funds are involved. You did approve this before the recess, but we had to wait a certain number of time for the cooperative contract in case there were any disputes. There were not. So this is simply putting forward on your agenda. You kind of already approved it, but just want to give one more check-in if you approve putting this on the consent agenda.
Yes, so we don't have a presenter for that, Gary. You
No.
just made the presentation.
Yes, I
Any
did.
comments or objections from commissioners on this? Seeing none, Gary, will that be on this Thursday's
This
agenda?
Thursday,
Okay,
yes, thank you. Next, District Attorney's Office. Excellent. Approval of a grant agreement from the Oregon Department of Justice for Child Abuse Multidisciplinary Intervention Program Services. Total grant award is $1,040,851.29, funded through the state of Oregon. No county general funds are involved. Please introduce yourself.
Good morning, Board. Chair Smith, my name is Scott Healy. I'm the first Assistant District Attorney here in Clackamas County. I'm also the MDT Chair for Child Abuse. So this is really a grant that well, you may have remembered, I came before you in November, just asked that we apply for the grant. Now we've received the funds. This is a grant that we've been applying for since the 90s. It's a biennium grant. We get it every 2 years. It's very important, of course, to fund the Children's Center. 85% of this grant money goes to the Children's Center and all the important work that they do there. We have one of the best children's centers in the state of Oregon. Some of the other funds are used for outreach and our NBT coordinator and training and supplies and things like that. So I sort of explained it in some detail in November, unless you want me to go into more detail. It's important money. It doesn't come from the general fund. It's state money that we've been receiving for, every year for a couple years. We're also asking for approval of the contract to the Children's Center. We only do that on a one-year basis as opposed to an every 2-year basis because the MDT will take a look at whether or not we want to, for whatever reason, change that contract.
Sorry, Scott, I don't see that item. There's just one item before us today.
Oh, okay, well, that's okay. We'll just go with the one item then. And then I thought that one was also submitted for you.
I guess you'll have to come back
Okay.
for that. Sorry about that, Scott. Commissioner Schrader, you have a comment.
So how much goes to the Children's Center? Is the bulk of that?
Well, we had forwarded the breakdown here, but so for instance, it's $1,040,851.29 that's coming to us. That's a biennium budget. So of $450,500 a year, we have set right now to go to the Children's Center, both for 2022 and 2023.
Okay, thank you.
Okay?
Any other comments or objections for the presenter? Seeing none.
Great, thank you, Scott.
All right, thank you.
Next, Technology Services, approval of an intergovernmental agreement with the City of Sandy to provide internet services to businesses along the Clackamas Broadband Exchange fiber network. The Clackamas Broadband Exchange will fund the expansion of the existing CBX network to interested businesses up to $3,000 per customer utilizing existing CBX funding and reimbursed by the monthly internet service fee. No county general funds are involved. Dave DeVore, Interim Director. Duke Dexter, Program Coordinator. Go ahead.
Afternoon, Commissioners, Chair Smith, Administrator Smith. By the way, from all of TS, Happy New Year. This is basically just an approval or request for an IGA, which formalizes our business arrangement with a ISP partner, SandyNet. We have one similar to this with the City of Sherwood. It just allows us to set up the formal business relationship that we have with them on providing enhanced ISP services to businesses that we can connect to on our CBX fiber backbone. We provide the infrastructure, they provide the services.
Great. Any questions or objections to the presenter?
Just a question.
Yep.
So essentially, anywhere where we have the fiber, a customer can receive a hookup fee benefit of up to $3,000. Not out of their pocket, but simply out of this fund, and that fund will, okay. And how much capacity do we have financially? How many customers can we hook up at $3,000 a piece or under this proposal?
It depends how fast they want to get on board, because we recoup our costs by the monthly fee that we charge them through them. We could probably handle, several hundred right now at the most. I don't obviously foresee that occurring, but we could handle a couple hundred connections, and then before we could have to wait and recoup the cost.
Okay, thank you.
Any other comments or objections? Seeing none.
All right, thank you. Next, Finance, approval of an amendment to a contract with Rapid Response BioCleaning for campsite cleanup and impact reduction services. The amendment adds $189,000 for a new total not to exceed value of $315,000 and extends the duration of the contract through December 14, 2024. This is an on-call contract with services paid by departments utilizing these services, some of which do include county general funds. Elizabeth Comfort, Finance Director. Go ahead.
Thank you. Good morning, Chair, Commissioners, and Gary Schmidt. This is an amendment to one of our strategic contracts that we have that comes out of procurement, out of the Finance Department, but really involves multiple departments to serve the county as a whole. This contract was initially signed in 2020 with a limited scope, and it was revisited by several of our departments like WES and DTD and NCPRD and our parks and facilities, and realized that if we were needing this contract, we would need to expand that dollar amount significantly. So that's why you see a greater expanse. We haven't used it very much, only about $5,000 so far, but should we need it, collectively the departments feel that we should have the capacity available for us in the next year.
Gary, since some of the money is general fund, has this been budgeted for?
Yes.
Thank you. Any other comments?
Yeah, I just give some context. So it says campsite cleanup. So is that something that is the responsibility of parks, or is this campsites that are basically those that are houseless?
All of the above, and that's why there's so many departments that are involved, because this is CCSO too, I believe, and that's where the county funds, the general funds would be involved. It includes parks, houselessness, curbside cleanup, all that would be necessary.
But it's not cleanup for legitimate camping at a bona fide park facility, whether it's NCPRD doesn't do any camping, but the county parks does, state parks do.
Not camping, just cleanup from houseless or debris that's not our regular campsite.
Does anyone in the room, can anyone in the room expand on this? Anyone? Sarah, Mike, Stephen? Anyone? Anyone? Anyone?
We use Rapid Recovery for abandoned RVs, but it's under a different contract than the one that Elizabeth is talking about now. We contracted with them separately, but that's what they do, but I'm not sure what services they'd be performing on this one other than park cleanup. So.
And how long have we been doing this?
We've had the contract since October of 2020.
2020, okay. All right. Thank you.
Commissioner Fisher, your hand is raised.
Yeah, thank you. So my questions are along the lines of what Paul was asking. Is this to move houseless? Is that considered camp cleanup?
I'm going to have to defer to the individual departments that participated in this amendment.
I'm pretty sure the answer is no. That's a policy decision the board would make.
Yeah.
We're not just doing that sort of work unless we're going to tell you about it first, board. But if you'd like us to get that answer before we move forward, commissioners, we can do that. I'm pretty sure the answer is no.
I would like that information. We have represented out there in the public that we are not removing homeless or changing homeless camps. And if that has changed, I think it's important that we know and we just understand what this will be used for. If it's for just cleaning up, that's one thing. If it's, with people that are living places, we need to know what's going on there.
All right, we will find out and get that answer before Thursday. Back to you, commissioners.
Commissioner Savas?
Yeah, I know it has the rapid response bio cleaning, which, tells me that's, health, someone could get ill if there's some kind of a biohazard or so forth. So that seems like a legitimate thing, but it also says and impact reduction services. So greater definition of that would be great at another time. I'm happy with moving it forward, but getting some better definition would be great. Yeah.
I think they can get that information to us so we can still carry on with this on Thursday.
Absolutely.
But unless something glaring comes up. Thank you, Elizabeth.
Okay, thank you. Next, Health, Housing, Human Services. First, approval of a subrecipient grant agreement with Tudos Juntos for PreventNet Community School Drug and Alcohol Prevention Services in rural Clackamas County. Grant agreement value is $190,000. Funded through the Oregon Department of Education. No county general funds are involved. Ed Johnson is presenting today. Go ahead, Ed.
Yeah, good morning, Chair, Commissioners, Gary Schmidt. Todos Juntos will provide prevention-focused team building activities, case coordination, and school engagement activities for drug and alcohol prevention programming targeting high-risk middle and high school students at rural PreventNet community schools in Candy and in Molalla.
Great. Any questions or objections for the presenter? See none.
All right, next, approval of an intergovernmental agreement with the state of Oregon acting by and through the Oregon Health Authority for access to the electronic referral system, Oregon Tobacco Quit Lying. Contract maximum value is $40,000, funded through Health Share of Oregon grant. No county general funds are involved.
Public health partners with Clackamas Health Centers, Multnomah County Health System, Neighborhood Health Center, and Virginia Garcia Memorial Health Center to strengthen the tobacco cessation initiative. This agreement maintains access to the regional partner health centers electronic referral system, Oregon Tobacco Quit Line.
Any questions or objections for the presenter? See none.
Next, approval of an intergovernmental agreement with Tualatin Valley Fire and Rescue for the Project Hope program. Contract value not to exceed $35,490. Funded through the University of Baltimore Combating Opioid Overdose through Community Level Initiative Grant. No county general funds are involved.
Yeah, community paramedics provide care coordination between patients and providers and community resource navigation with a focus on treatment and recovery services. They work with patients to establish a longer-term plan to prevent future substance use and potential overdose.
Any objections or questions for the presenter?
I don't have any objections. Happy to move forward with this, but I just can't imagine how far $31,000 would go. So any idea how many people might benefit from that? I mean, how many people served?
Good question. I do not know, and I can ask and get that.
Yeah, appreciate that. I'm happy to move forward with it, though.
Go ahead.
All right, next, approval of an intergovernmental agreement with Clackamas County Fire District Number 1 for the Project Hope program. Contract not to exceed $31,090, funded through the University of Baltimore Combating Opioid Overdose through Community Level Initiative Grant. No county general funds are involved.
Similar to the last one that was just presented, paramedics provide care coordination between patients and providers and community resource navigation with a focus on treatment and recovery services. They work with patients to establish a longer-term plan to prevent future substance use and potential overdose.
Any comments or objections? Seeing none.
Next, approval of an intergovernmental agreement with Clackamas County Fire District Number 1 for medical direction services for their emergency medical program. Contract maximum value is $72,000. No county general funds are involved.
This agreement provides the basis for a cooperative working relationship with Clackamas Fire District 1 for medical direction, such as developing a program to ensure they meet the state requirements and to establish performance standards. This agreement will ensure that Clackamas County Fire District Number 1 first responders meet requirements and protocols for the provision of EMS care.
Any questions or objections for the presenter? Next.
Next, approval of a non-federal subrecipient grant amendment with Northwest Housing Alternatives for system diversion, homelessness prevention, and rapid rehousing services. Amendment adds $60,000 for a revised maximum contract value of $600,000, funded by the State of Oregon Housing and Community Services Department. No county general funds are involved.
This agreement is funded with emergency housing assistance state grant funds passed through to SSD, Social Services Division, from Oregon Housing and Community Services. This agreement will extend the date by 6 months.
Any questions or objections? Seeing none.
Next, approval of a revenue agreement with Care Oregon for integrated care model expansions funds intended to provide financial support for the construction of the new integrated Sandy Health Center. Maximum agreement value is $500,000. Funding is through Care Oregon. No county general funds are involved.
These funds will be used to support construction of a new health care facility located in Sandy, Oregon. This facility will integrate physical, behavioral, and dental health services. The new facility will allow Clackamas Community Health Centers to expand services to better meet the needs of Care Oregon members and to provide transportation support for those members.
Any objections or questions for the presenter? Seeing none.
Next, approval to apply for a funding opportunity with the Oregon Health Authority, COVID-19 school-based health and recovery funding, fiscal year 2021-2023. Award amount will be up to $150,000. Funding is through the Oregon Health Authority. No county general funds are involved.
If awarded, health centers would utilize the funds to hire a new staff member that would bridge services over holidays and school breaks, provide zero suicide support, and do intakes in order to maximize more senior level staff members' time with clients.
Any objections or comments for the presenter? Seeing none.
Next, approval of an amendment to an intergovernmental agreement with the State of Oregon, acting by and through the Oregon Health Authority for the operation and financing of community mental health, addiction treatment, recovery, and prevention services, and problem gambling programs. Amendment adds $98,582.78 to the agreement, increasing the maximum value to $9,238,209.62. Funding is through the State of Oregon, Oregon Health Authority. No county general funds are involved.
Amendment number 6 adds $98,582.78 to the agreement for aid and assist client services, which are restoration services and periodic assessment of a defendant's capacity to stand trial as required by ORS while the defendant resides in the community.
Any questions or objections? Seeing none.
Next, approval of an intergovernmental agreement with the University of Baltimore to accept a grant subaward for combating overdose through community-level intervention initiative to expand the capacity of Project Hope. Total grant award is $233,457, funded through the University of Baltimore. No county general funds are involved.
Public Health requests the approval of an IGA to accept grant money from the University of Baltimore. This grant will be used to expand the capacity of Project Hope, which will enable additional overdose prevention and care coordination services in Clackamas County.
Any objections or questions? Seeing none.
Finally, approval of a subrecipient grant agreement amendment with Ant Farm Incorporated to provide rent assistance to households impacted by the COVID-19 crisis. The amendment adds $2,532,377 of federal emergency rental assistance funds and reduces the Community Development Block Grant COVID funds by $409,946 due to the availability of the federal funds. The amendment also extends the agreement through June 30th, 2022. The new contract total fund value is $11,442,019, funded through federal, state, and housing and urban development grants. No county general funds are involved.
Any questions, comments, or objections from the board on this particular item?
Ed, do you want to say anything about it, this program?
Um,
I kind of covered
Sorry,
a lot there.
sorry about that,
You're
Ed.
fine. You're fine.
I was thinking ahead regarding the ant farm. Go ahead.
Yes. Under this agreement, AFRM will receive referrals from Clackamas County's Coordinated Housing Access Program to determine eligibility and provide rental assistance payments on behalf of eligible households impacted by the COVID-19 pandemic crisis.
Any comments from commissioners on this? Ed Johnson, thank you very much for coming forward today.
Thank you.
Thank you, Ed. Next, Business and Community Services. Approval of a resolution establishing rural Clackamas County as a rural renewable energy development zone. The fiscal impact will be limited to the abatement of property taxes on the new investment portion of the zone application and only for the eligible portion of the new investment up to 5 years. No county general funds are involved. Sarah Ekman, Interim Director, Cindy Moore, Economic Development Wizard, leader of the, sorry, Cindy. Economic Development Team.
Thank you, sir.
You're awesome, Cindy. Go ahead. As you, Sarah. Go ahead.
Wonderful, thank you, yes. So Cindy oversees our Enterprise Zone program, and we're just going to give you a quick recap on this morning and where we're at with the resolution for Thursday. Good morning, Chair Smith, Commissioners, and Administrator Schmidt. Happy New Year. Cindy Moore, Business and Community Services. As a refresher, the Rural Renewable Energy Development Zone is an incentive offered. We did have a Rural Renewable Energy Development Zone in place for the last 10 years. It expired at the end of June of last year. At the end of July of last year, we came to you with a request to redesignate the Rural Renewable Energy Development Zone in Clackamas County. So it would be a 10-year tax abatement opportunity for companies who are looking to invest in harnessing wind, geothermal, solar, biomass, or other unconventional forms of energy in Oregon to generate electricity. This is an opportunity and an economic development tool that we would have in our shop to be able to support companies who are interested in expanding in our county. So since July, you may be wondering what we've been working on. We've gone out to the taxing districts, provided all that information, received no comments. Actually, we had a couple of questions that came in from the cities about zoning. We were able to answer those accordingly. We have finalized the resolution, which is in your packet with County Council. And now we are here with you today to request a formal approval to submit our application to Business Oregon for consideration of the zone.
Thank you very much for that. Questions, comments for the presenters on this?
Well, I don't have a question to the presenters, but I do have a comment. I really think back in our prior structure, we used to have work sessions on things like this. And granted, there are no county general funds, but there are or would be general fund impacts. Obviously, if someone jumps in on this, we would not receive property taxes, and it's not really. It seems to me that I certainly miss having the prepared documentation in the work session, and I think that's an appropriate place, and I think having this on the consent agenda is not doing our due diligence. That's my comment.
Commissioner Fisher, you have your hand up.
Yeah, thank you. And I really agree with Paul on that. I was going to say I would appreciate a work session on this. It does affect our bottom line, and I'm very concerned about safeguards in programs like this, making sure that there is appropriate criteria, that it's being followed, that the entities that take advantage of these opportunities, that there are safeguards, and we are the ones that are accountable because we're approving this abatement. This is the way that we can be moving in the future, and we really need to know what we're doing. So I agree with Paul. More information and a work session is warranted here.
Gary Schmidt.
Yes, thank you, Commissioner. So you did discuss this at issues in July. There was quite a lengthy memo that staff prepared, and my memory is you took like almost 20 to 30 minutes to discuss this. So we're calling it a different thing, but you did have a discussion about this, and staff heard your feedback and input, and then that's why we're coming back to you for the end result here.
Yeah, I do remember that. Commissioner Schrader. Martha, is your microphone on?
Because I don't
Thank
want to
you.
sniffle into the
That's okay.
phone here. So I'm fully in support of this because, number one, we've been doing it for 10 years. Property tax abatement is a tool that we've always used to encourage economic development, and this is in one of our rural areas. And in my knowledge, working with economic development, there are already significant sidebars in place that need to be met for that tax abatement to happen. What could you tell us what some of them are, Cindy, off the top of your head about what those
What
are?
might be helpful too, just to clarify for the public
Yeah.
and for the board in general too, is that the abatement does not apply to the value of the land itself. This would be, if a project
Right.
comes into a community, the abatement would be for 3 to 5 years on the new investment that they're making in the community in the form of machinery and equipment, or
Okay.
buildings and structures. So I should have clarified that again.
That's not a property tax
Correct.
abatement, it's just, okay.
That is
Got
exactly
it.
true. So, and the memo that we prepared back in July went into that a
Mm-hmm.
little more detail, and I can certainly field any more questions if you'd like, but it applies to the investment that's being made, nothing to do with the land, only thing above.
Commissioner Savas?
I appreciate, I do understand that, I appreciate that, but it seems like our financial, the financial integrity, or if you want to call it that, going forward of the general fund and the increasing pressure on our general fund, I think we have to really, really be careful, more than ever. The other thing I've discovered too is, in my 10 years here, 11 years, is that sometimes these developments put burdens on our roads, and we are not actually keeping up with our infrastructure. And so, there's no, there may or may not be an SDC or anything else that can be used out there. I'm not really sure. But I'm just kind of concerned that it will have impacts. And sometimes we don't really recover all those funds through SDCs adequately.
Additionally, we as BCS can certainly bring forward a session on incentives that we have in the economic development realm. There's others in addition to this, so I think it would be a well-rounded conversation if we could bring that back to you.
Well, Commissioners, do you still want to proceed with the policy session on this? As far as the calendar is concerned, just note that it will be several weeks out until we're able to revisit this because of scheduling. People have already, departments have already requested policy session on issues, so I'm not sure how soon it will come.
I'm fine not having a policy session
Okay.
myself, but I don't know if I'm the majority of the
I'm fine with not having a policy session. Commissioner Fisher, and do you still want a policy session?
I think it's important, and Martha, I appreciate your view, and I really rely on that because you are our liaison with the business community and a lot of these issues. But having us as a full board really aware, and I like what Sarah brought up about an overall view of looking at incentives and what we can do and sort of the levers there. I think that is important for us as an entire board.
Commissioner Scholl, you have your hand raised.
Yes, I am comfortable moving ahead and approving this agenda item without a policy session.
I'm wondering if we move ahead with this, we have three, it's basically a 3-2. In the past, any two commissioners who wanted something to put on the agenda, we always allowed that. However, this has been on the agenda before, and we are discussing it today. I'm wondering if it's possible from staff to go ahead and recirculate that memo that you talked about from July, and then answer any additional questions that the commissioners may have on this in preparation. Now, we don't have to have it on the consent agenda for this Thursday. We can wait a week and do it next Thursday. Is this time sensitive?
No, ma'am. It's at the purview of the board to implement.
Okay.
And it would be
Why
then
don't we
effective
take a little bit of time on this, Gary? We won't consider it this week, but let's try to get some more information out and see if the questions can be satisfied. Is that
Certainly.
okay?
That's very doable.
Okay. Board, is that okay?
Sure.
Oh,
That's
okay.
okay.
All right, thank you very much
Thank
for
you.
coming forward.
Thank you.
Okay, got it, thank you. Next, Transportation and Development. First, approval to accept an easement and equitable servitude for Clackamas County leaking underground storage tank site. Fiscal impact is unknown, but expected to be minimal. Funded through the Clackamas County Road Fund. No county general funds are involved. Dan Johnson, Director of Transportation and Development. Go ahead.
Chair Smith, Board, Happy New Year. Congratulations, you have a leaky underground storage tank site.
Wow.
Essentially, since the 1920s, Clackamas County has owned and operated the 22-acre site down off Abernathy. It's the site of our current location of transportation maintenance and DTD at one point in time. Had administrative offices, paving, equipment storage, and obviously some underground storage tanks. About 2.4 acres of that site were historically fueling and automotive services operations, resulting in underground storage tank, underground groundwater contamination from those tanks. Those tanks were decommissioned at various times between 1991 and 1998, after which those fueling operations were discontinued. However, DEQ had those files open for almost 30 years. There have been a number of attempts to close them. This process was a direct result of the disposition of this site, and as it was a requirement of the disposition that we basically go forward and get a no further action from DEQ, which approval of this easement will essentially complete that process and that task. We've been in close contact with County Council on this. They reviewed and approved it. And essentially what this easement is, for those of you who haven't dealt with Superfund sites before, or groundwater contamination, it establishes a perimeter, and when you go in that perimeter and do certain type of work, essentially it sets requirements for that kind of work. I'm going to go real quick and talk about why we don't know what the contract amount is, or what the amount of the cost is. That cost is determined by what work at a future date somebody will do. So if someone does work in that area that requires DEQ review, whoever that entity is, if it's Clackamas County or some other entity, they are required to pay for charges for DEQ to review those materials. Okay? That's about all I got. I'd be happy to answer any questions you got.
When I was in the legislature, laws were coming out right and left about the underground fuel tanks in Oregon, and certainly in my legislative district, it was quite common. So I've had a little bit, tiny bit of experience with this, Dan. So this DEQ requirement sounds to me like it's going to carry on from one owner to the next on this particular property. Now, has the contamination abatement been completed on this site?
So the contamination is approximately, I think it's 12 to 15 feet below ground.
Yes.
And so essentially, we have not abated all of that. But what DEQ has agreed to is that there are certain just requirements if operations occur at that depth.
Okay.
And only for certain types of operations. It's mostly around, so for example, if residential development went in there and they had to excavate for utilities at a depth of that nature, you know what? There's a requirement that you have certain expertise on site to make sure that if they identify contaminations, where you dispose of that material at, things of that nature. And that would go from, it would go into perpetuity from property owner to property owner, as you said.
And the new owner has been notified?
Yes.
Okay, and they're okay?
Yes.
Okay, any other questions or comments, objections for the presenter on this topic? Seeing none, go ahead.
All right, next, approval of a contract with Kittleson and Associates for design services for the Billquist Elementary School sidewalks. Total contract value is $527,632, funded through the Oregon Department of Transportation state grant and partially matched by system development eligible funds. No county general funds are involved.
County received an ODOT Safe Routes to Schools infrastructure grant to install bike lanes and sidewalks on Webster Road between Roots Road and Bixel Way. I'm here to inform the board that we have, this project was advertised in accordance with ORS and LCRB rules on August 11th, 2021. Proposals were opened on September 9th, 2021. County received 2 proposals. Those proposals were evaluated, and essentially, we are respectfully recommending the board approve and execute the contract with Kittleson and Associates for design services for this particular improvement.
Dan, is this a result of road construction in the area?
No, these are basically targeted grants and projects for deficient areas. Essentially, you have circumstances up there where they have narrow shoulders, not a lot of ability for folks to walk and commute back and forth. So.
Right, and how long is this sidewalk? Do we know?
The total project length is about 1,300 linear feet, and it takes into account the reconstruction, 7 reconstructed and 13 new ADA compliant intersection curb ramps.
Great, great. Well, hopefully the walk to school will be a little easier.
Yeah.
As we all did with ice on our backs and through snow. And yes, exactly. Now there will be a curb and a walkway for them.
Yeah, now we can ride our bicycle on cement. Boy, as a kid, I never got to experience that, but that's okay. Kapal.
Yeah, just when, I see the design part, but when would we anticipate actually breaking ground?
I'll have to get back to you and confirm with that when it's in our construction schedule. My assumption is it's probably 2 years out, but I'll confirm that and get back to you and let you know.
Okay, thank you.
Okay.
Okay, Dan, please stay here. So that concludes the consent agenda items. All of these will go on this Thursday's agenda, except for the business and community services item. We'll pull that until next week. And then the finance one will still go forward on the cleanup, but we'll get the questions answered you've asked for, and you can always pull it this Thursday if you're not satisfied. Okay, thank you. I'm going to jump on back to the issues list. I'll juggle this a bit. Next, let's do Crescent Road transfer hearing request.
Great. I'm going to keep this short and sweet. The city of Sandy and Clackamas County have come to an agreement to transfer Crescent Road. Basically, that road is entirely within the incorporated area of the city of Sandy. There are no funds associated with this transfer. It is simple jurisdictional transfer of the roadway.
And when is
And
that?
we are requesting a hearing on February 17th to finalize the transfer.
Okay, any questions, comments, or objections about this? Seeing none.
Excellent, thank you. Let's do the update on Ridwell next, please. Dan, go ahead.
I'm going to read this verbatim so I don't mess this up. So we have a number of experts in the room, not only from the council side, but also from our solid waste side if there are detailed questions. Recently, a company known as Ridwell Incorporated has begun offering services in the Portland metropolitan area, including urban Clackamas County. Ridwell launched initially in the Seattle area as a venture capital startup that offers subscription-based collection and recycling of hard-to-recycle materials, such as plastic film, styrofoam, batteries, etc. The materials collected for recycling by Ridwell are defined in state law and county code as solid waste rather than recyclable material because the cost to recycle these materials is greater than the cost to discard them. Our code requires that the collection of solid waste for a fee occur only by our franchise haulers or their subcontractors, and does not actually contemplate a service such as the one proposed by Ridwell. It should be noted that Clackamas County has supported recycling in our code and programs for decades. Historically, recycling opportunities have been provided through a combination of curbside collection, which we're all familiar with, and complemented by free drop-off and recycling locations throughout the community. Earlier this year, based on staff's understanding of the county code, Ridwell was sent a cease and desist letter outlining the alleged code-related issues, and requesting and inviting the company to advance in a dialogue with staff. Ridwell responded. They disagreed with our interpretation of county code and essentially continued service. The county sent a second notice to cease and desist in November, and based on this letter, Ridwell informed the county that they temporarily suspended their fee, thus placing them essentially in compliance because they're not charging for the service. Our staff has researched the policy options for providing Ridwell-type services in Clackamas County, and staff intends to engage in a discussion with the Solid Waste Commission, and we'll be requesting a policy session from the board to provide options for consideration. Current policy options include one, a recycling license, amending the county code, existing definition of recyclable materials, and the recycling license system to allow providers such as Ridwell to offer services for compensation and appropriate fees and conditions. Second would be expanding our franchise collection for consideration, directing existing franchised collectors to expand their service available to subscribers to accept materials similar to those accepted by Ridwell. There's an attachment A that provides a pretty thorough review of kind of the history and the services provided. Thanks so much to our solid waste staff. But in short, going forward, staff will be engaging in a discussion with the Solid Waste Commission to develop a recommendation for future consideration by the Board of County Commissioners. This process will include discussions with our current franchisees, the public, around the provision of these services. Before we do so, we are here in front of the board to basically ask you if there are anything or considerations the board may have on this particular topic.
Oh, I think there probably is.
I would imagine there probably is.
Yeah, so let's talk about process for a moment. Before you bring this to the BCC, shouldn't it go through the Solid Waste Commission for a complete review first?
That's exactly what we're looking to do.
That's what they're telling us.
Yes, and I think maybe that's what we'll do. Secondly, I'm concerned about our current franchisees who are providing services. And now we have this company coming in decided to do this, and now they say they're in compliance because they're not charging a fee. I don't see how that is fair competition with our other franchisees in the county. Moving forward, I'm open to having this type of service in Clackamas County. I'm open to competition, but I do believe it needs to be fair with our current franchisees who over decades and decades have followed the rules and regulations, have tolerated their businesses being really frankly abused by government. Many fee increases, rate increases, tipping rate increases from Metro, and I do believe we need an open dialogue with them. The Solid Waste Commission needs to do that moving forward. What do you think, Dan?
Thumbs up.
Thumbs up. And we've all read some emails, which I think the emails that we have received have been maybe one-sided and not completely altruistic in nature. And I will make a comment, only comment on that. And I think as we explore this further, more information will be getting out in a very public way. How soon do you think the Solid Waste Commission can take a look at this?
As I peer back into the crowd.
Please come forward.
February, March, probably.
February, March.
Yep.
I suggest that try to do it in February if it's possible. How many members are on the Solid Waste Commission? 7?
7.
Okay, and how often do they normally meet?
Monthly? As needed. As needed.
Oh, as needed, okay.
Yeah.
Well, now they have something to do.
They do. They're a valued tool that we basically talk about our rate structures and things of that nature. They review a lot of that, and as needed, as other topics arise, we bring them forward for discussion. Yep.
And we may need to revise our county code. I don't know. If we're going to, now I read this through thoroughly. It's a recycling license and expanding the franchise collection, which would be made available to everybody, obviously, correct?
Yep.
Not just Ridwell. And if we do either one of these two, we would have to change county code, correct?
Only the one option, I believe.
Recycling license?
Correct. Yes.
That I don't understand why, but you know what? You guys are going to figure it out and
We're gonna-
explain it to us.
And we're going to figure it out, and we're going to come back with a recommendation for our Solid Waste Commission while we engage in discussion with our franchisees and our haulers.
Yeah, please, that is just really important. Commissioner Savas.
Yeah, I just, I appreciate all the dialogue. I won't duplicate anything here or repeat anything, but one thing that I think needs to be said is that we have to be environmentally responsible. When I say we, that's all of us, right? And on behalf of our environment here in the county, and also look out for what's in the best interest of the consumers, if you will. So if there's an opportunity for people to be incentivized to economically dispose of their things, that should be an incentive to, number one, protect the environment, and two, protect their bottom line. I wouldn't want to see people paying for something that they would otherwise get free. But I think consumer protection, price controls are, I think, part of something we encumber when we get in a franchise situation. We franchise a couple things, and we do that because we want to assure that the most remote areas, the most difficult to serve, are served. And that's why we franchise. We don't franchise it as a profit center for the county by any
Right.
means whatsoever. It's simply to make sure that everyone and everywhere in the county regionally is covered. That's the purpose of the franchise.
Yep.
That's my
I
comment.
think-
Thank you.
I think your points are very well taken, and I'm sure that folks, the Solid Waste Commission will look at all that in mind. Any other comments from commissioners on this particular topic? Gary?
Great, thanks, Dan.
Yep.
Next, again, shifting order, advisory board and commission appointments. Shannon, go ahead, please.
Thank you. We have 3 ABCs today. The first is the Community Health Council, which is staffed by the Health, Housing, and Human Services Department. They have a minimum of 9 members. They currently have 6 members, so 3 vacancies. They only have 1 recommendation for us today, and that is Helen Watt, being recommended for her first term.
I have a comment on this. This is, this Health Commission is a federally mandated commission, correct?
That is correct.
And we're required by law to have 6 community members. Am I saying that? It's a 9-member commission, but we're required by law to have 6. We don't have 6. By not having 6, I want to know, or not having 5, or whatever the amount of community members, are we in violation of something? Do we need to, for instance, Joe, would you?
Ed,
I'm sorry, Ed Johnson,
Can you answer these
please.
questions, Ed? Can you come
Yeah.
forward, please?
Beg your pardon, Ed.
No problem. Ed Johnson, Health, Housing, Human Services Department. So Health Centers is required by the Health Resources and Services Administration to have a minimum of 9 members, maximum of 25. Of the 9, there always needs to be a maximum or majority consumer members, and consumer is defined as a patient or a client of health centers. And so if there's 9, so there always need to be at least 5 consumers, and then 4 non-consumers or community member.
Okay.
And yes, there must be a minimum of 9 at all times. And if not, then a recruitment plan to get to that number again.
So maybe we need to up our recruitment a little bit to try to get to some consumer members. It's difficult now getting folks who want to volunteer because of the climate. I don't know, maybe we could make postings at our clinics, if you're interested in public health and serving, would you like to do that? Outreach to some of our health professionals in the county who may know of consumers out there. Maybe they've treated them. Might help us get some more members. Now, if we don't get the 9 members, what's our situation?
We have to have 9, so there is.
We have to have 9, but we don't have 9, so we're not in compliance. Is there a
Exactly.
date on this?
Yeah, so I know that Health Centers is working with their project officer at HRSA, Health Resource Services Administration. They have a recruitment plan, and they're working with PGA on a press release. This is Health Centers. So yes, they're working with flyers and then press release with PGA, using all avenues in order to publicize that there are vacancies. I know that they have some consumers, some clients, patients who will be attending this month's Community Health Council meeting. And then, of course, we have Helen, whose name has been proposed today as a potential member. So.
Okay.
Yeah, I just want to add, have one of our staff, or have Everett, some people inquired about, a couple people I know inquired about how they can volunteer on some committees. So if there's an opening there, I think they'd be interested in that. So
Great.
I move for approval.
Commissioner Savas has moved approval for this particular appointment for the Health Council, and Commissioner Schrader has seconded. Comments? Commissioner Schrader? No comments. Hearing none. Shannon, please call the poll.
Commissioner Fisher?
Aye.
Commissioner Scholl?
Aye.
Commissioner Savas?
Aye.
Commissioner Schrader? Chair Smith?
Aye, motion passes 5-0. Up next.
Up next is the Developmental Disabilities Council, also staffed by Health, Housing, and Human Services. They currently have 3 provider and 1 advocate opening due to term expirations. Their initial recommendation is as follows: Kalkadan Mimi Ezra, first term; Jacob Tolbert, first term; Sarah Lambert, first term; and John Merrick, first term.
Move for approval.
Commissioner Savas has moved for approval for the Disabilities Commission of the names listed here. Commissioner Schrader has seconded that motion. Any other further discussion? Hearing none. Shannon, please call the poll.
Commissioner Schrader? Aye. Commissioner Fisher?
Aye.
Commissioner Scholl?
Aye.
Commissioner Savas?
Aye.
Chair Smith?
Aye, motion passes 5-0. Thank you very much. What's up next?
The final commission today is the Compensation Board for Elected Officials. They currently have 1 opening on their board due to a term expiration. The recommendation is Alyssa Grandy, appointing to her 2nd term.
Move for approval.
Second.
Commissioner Savas has moved to approval for the Compensation Board. Commissioner Schrader has seconded that motion. Any further discussion? Seeing none. Shannon, please call the poll.
Commissioner Schrader?
Aye.
Commissioner Scholl?
Aye.
Commissioner Fisher?
Aye.
Commissioner Savas?
Aye.
Chair Smith.
Aye, motion passes 5-0. Thank you very much.
Thank you, Shannon. Commissioners, just a time check. We're not going to finish this list in the next 10 minutes, so, and it's because you're on recess. We just have so much to catch you up on. Are you all able to stay past the noon hour? Would you consider coming back in the afternoon? Do you want to start earlier tomorrow morning? You have a full agenda tomorrow as well, but I'm sorry, we're not going to finish in the next 10 minutes. What would you like to do?
Okay, what do we have to do, Gary?
We have to talk about the new law about public participation remotely. That's probably the most urgent. Poor Mike's been sitting here all this time. I'd like to do the NCPRD item, and then Commissioner Communications. The other stuff I can hold.
Commissioners, do you want to stay?
Yeah.
I think we can stay.
I'm ready just to
Gary.
work through.
Just maybe a short break.
Okay.
At noon.
And Paul, can you stay?
I can stay, but as long as you just get a short break. We'll get Mike up here first.
Okay. Thank you, Commissioners. I'll go as quick as I can. So next, North Clackamas Parks and Recreation District Board meeting schedule. Chair, would you please convene the board as the NCPRD Board?
Yes, I certainly will. I will now, there we go. I will now adjourn as the Board of County Commissioners and reconvene as the NCPRD Board of Directors. Thank you, Mike.
Thank you. So Mike Bork, Director of NCPRD. I'm the District Administrator for NCPRD. Mike and I have been talking, and we have a suggestion, a recommendation for you Commissioners, and that is to formally have the District Board of Directors, which you sit as, to meet separately from your Board of County Commissioners meetings, and to meet within the district. You've done this in the past, but not consistently. And that would be within the boundaries of the Parks District, which could be at the Concord School, at the Sheriff's Public Safety Training Center, the Aquatic Center, and multiple options there for you. But the suggestion is you formally meet as the district board, and that's all you do, have business as the district board. It could be monthly, it could be every other month, it could be weekly, that's up to you. Maybe not weekly, but Mike and I are recommending that we go back to that format and actually do that consistently, especially now with the Concord School, the library. There's a lot of interest in parks issues, and this way separate it totally as a district board, which you are. Mike, would you like to add anything to that?
Thank you. Mike Bork, NCPRD Director. Happy New Year, everybody. As we were thinking about it, especially in light of the fact that we do have our District Advisory Committee, I was going to put forward the idea that we try and, at least at the start, look at a quarterly meeting where we can be doing a lot of the prep and getting the advisory work from the DAC. And then every quarter, we would basically have a meeting to have a lot of meat and potatoes in the meeting, not just meat to meat, but actually be taken care of, whether it's contracts or discussions or policies. Obviously, there may be some things that become a timely nature where we can't schedule it for that quarterly meeting, and we may need to do an interim one, like, in just a normal process. But the idea would be that we would have an in-district chance to have the one-on-one focus to a lot of, as Gary said, a lot of the issues that we're going to be having come up that need your attention.
And this is in person.
That would be my recommendation.
I would like to do it in person. I think the communication is really important, just to be able to talk about what needs to be done, about goals, about expectations, get to know some of these people. I certainly would want to get to know some of these folks better. Commissioner Savas, do you have a comment?
Yeah, I think this is one good first step towards recognizing that it's a district. It requires autonomy, and I would support meeting at the Concord School District, particularly because the other two venues are improved venues, and the unimproved portions of the district, which I will just put my editorial on, have been, I think, substantially neglected and haven't received fair treatment. I think it's an appropriate venue.
Okay. Well, they'll work on that.
Would you agree to start once a quarter? To start?
Yes.
Would that be all right?
Yes. Any other comments?
Or as needed, frankly, if there's something meaty that comes up, I think, most districts meet monthly, but I agree with Mike, there's no need to meet just to meet.
Other commissioners on Zoom?
No one's hands raised.
No one's hands raised.
I'm sorry, I didn't raise my hand, but I'll just go ahead and weigh in.
Go
I think
ahead.
for now, until the cases for Omicron come down, it'll be important to have virtual as an option.
Absolutely. We'll do both. We're going to talk about that in a second. We're required to do both. So it'll be in person, but there'll also be a Zoom capability.
And we're anticipating probably February or March for the first one, just to be able to put together and strategize how to do all of that. But
Regarding our schedules, probably March is going to be more doable.
And I'll work with Gary and his
Thank
staff,
you.
and we'll coordinate it.
Yeah,
We'll come up
Mike,
with
thank you for coming
you.
forward. That's a good idea.
Appreciate it.
Thank you, Mike, for the excellent idea. We'll come up with a plan for you. These will be evening meetings, by the way,
Yes.
so that the public could attend.
Yep.
So,
And our Concord Learning Center room that's set up, I think is a perfect venue.
Yep.
So we'll let you know as things develop.
Okay.
Thank you.
Excellent. Thank you, Mike.
2022.
Thank you, Mike. You would now adjourn as the district board.
I will now adjourn as the Board of the NCPRD and reconvene as the Board of County Commission.
Take a break.
Yes, we will. 5 minutes and we will reconvene. Thank you.
2560, the law has changed, effective now. Stephen's going to tell us all about it, please.
Sure, thank you. Good afternoon. So the Oregon legislature basically codified what this board has been doing for the last 2 years during its public meetings, which is to allow for remote participation and observation of your board meetings. And so what the new law requires is that, to the extent practicable, executive sessions accepted, that if the board has meetings, that you'll have a Zoom link available. And then if you are taking in-person testimony, such as a public hearing or your public comment, you will allow people to appear remotely and speak to a particular matter. And if you are taking written testimony, such as a public hearing or a road transfer or something like that, or a code change, if you're taking written testimony, that you will allow for people to submit written testimony during the course of the meeting itself. And that is one change that would be from our current practice, where we state that written submissions must be submitted, I think it's 10 minutes after we start or something along those lines. So if written submissions are allowed, you will need to do it for the duration of the meeting itself. That means that somebody would have to be tracking the email box, inbox, or whether it's a fax or whatever mode we have for receiving it. My understanding it is it's primarily email. But those are the changes to it. So basically, we will continue to have Zoom links available on all NCPRD meetings, all BCC meetings, not executive session again, but it very well might be applicable to all your ABCs eventually as well. This speaks to the governing body, but there is the Attorney General's report states that there are some groups, because they could be final decision makers making recommendations, budget committee, for example, that they might be considered governing bodies. So I say we start with the BCC, NCPRD, and any other official capacity in which you serve, and see how it works and go from there. And if other ABCs want to adopt something similar to that, because I do think you're going to get asked to have more remote participation in a variety of sessions, Housing Authority, for example, with Commissioner Leestra, something along those lines. So it's a minor change. Again, it's just saying that this technology is here to stay in the public meeting forum.
Gary.
Several questions, if you don't mind, Commissioners. So right now, we say you have to register in advance. Can we still do that, or do we have to stop doing that?
Oh, you can say register in advance. That's for orderly participation and things, and to gauge how many people we have appearing, because if you give them 3 minutes, we like that, but it'd be during the course of as well.
So we can no longer say you must sign up to speak 5 minutes after the meeting starts. We have to allow that right up until public communication? And during public communication?
Yes.
Okay.
Yep.
Got it.
Yep. I would say in an abundance of caution to keep, because it says for the duration.
Okay.
Yep. Your public communication is entirely at the board's discretion as well during your regular meetings. If you don't want it, you could discontinue it. If you want to limit it, you could. But correct, you keep it open throughout.
And as far as emails, we've always allowed those at any time. We don't restrict those, but we don't read them out loud. Do we have to read them if a constituent sends an email during a business meeting? Do we have to read it?
No, you would not.
Okay.
If it were, it's basically going to be part of the record itself. They just have the opportunity to submit it. And there might be some that you would want to read. It depends on what they are.
Okay.
If it's a public hearing, though, you might have opportunities, like during the Hoodland one, there might be people up on the mountain submitting written things. I just logged on, what about here, here, and here? And that might be a little bit more, extemporaneous type of interaction.
Okay. I'm sorry, one more. For the actual business meeting, may we require or request that a constituent register to speak? Or are they allowed to just go online and then raise their chat hand if they want to speak? Or can we say, no, you must register and express your intent to testify, just like a blue card?
You can have them register.
Okay.
Yeah.
Great.
Yeah. This is an access and observation component, yeah.
So, but they can register at any time? Yeah.
I would say you should encourage them to register early so you can gauge the duration and administering of the meeting itself. Like if you have 40 people registering,
Right.
it's a lot different than 4 people registering. But yes, I would say register early people, but I wouldn't encourage prohibiting somebody from speaking because
Right,
they
just
didn't
because they
register.
didn't get within the time frame. Okay.
Exactly.
Yeah, and then it's also becomes a management issue as far as time is concerned. And when does this go into effect?
Effective immediately.
Okay,
Yep.
so staff needs to readjust my script
Yep.
for the business meeting. Okay, good. Paul?
Yeah, I presume that the idea is to have as equal access as one would walking into a room. Essentially, when I walk into a room of a public meeting, I can see who's attending, right? I can see who's around the table. I can maybe garner their names off their placards. There's an agenda that's got the names on it of the folks that are there. Or maybe when someone's speaking that are identified, in a Zoom meeting. I mean, all the things that one would enjoy attending a meeting in person, one should have equal access to on Zoom. And I know that some Zoom meetings I have seen, I have been in the audience of, I have no idea who the people are. So not our meetings per se, but maybe actually some. So I think it's somehow we need to calibrate, adjust to that one thing. Another thing I want to just state, is that we just had an NCPRD meeting, okay? Anyone who wanted to join that had no notice of it. As far as NCPRD. If you go on the NCPRD website right now, there's no notice of the meeting we just had. So that's another thing I want to identify. Number three, that is that there are more open, obvious usage of text between members during meetings than ever before. And it's very evident on Zoom, for example, and even citizens contacting board members, talking to one another on text, and committee members inputting on text, but the public has a right to know what those communications are. So I'd like to know how we're going to adjust for that in a more difficult environment that Zoom creates, right? I think that covers it. Those are the three.
The statute doesn't speak to text messages. It's basically remote participation and observation and attendance, virtual attendance at board meetings. The text issue has been and will continue to be a challenge for those individuals such as myself who receive public records requests for text between electeds and or your constituents and or other folks, access of which would be limited by the county. I don't own that phone, you do. So that will continue to be an issue. There's really nothing I, as county council, can do to stop it. I would encourage preserving them. I would discourage doing county business by text, but I will admit even I do it. Gary and I communicate on occasion. Can you come up now? Meetings running late, things along those lines. But I preserve those. I have it indefinitely on my phone itself. So it's a very valid point, but I don't have the answer.
Yeah, well, staff is one aspect of it. The public has a right to listen to all the content and information that is discussed, deliberated, and so forth. And That does not happen exclusively. And again, because the use of texts are ramping up, that's my observation more than ever. I think we need to somehow find a way of making it formally in the announcements somehow. But that's a tall order to expect the public to file a public records request for information they really don't have, right? And identify it, because it's unknown to them.
Okay, my opinion on what you just said about publicly announcing something in text messages, I'm not inclined to do that, nor in the introduction. I disagree with Commissioner Savis's interpretation of text messages with staff at meetings. Oftentimes, as chair, a person will come forward to testify. I will have a point of clarification. Stephen, can you comment on this? Gary will text me, oh, so-and-so is in the queue. We need to do this. I need to speak, and blah, blah, blah. It's a management of the business meeting that I think the technology of texting allows us to run more smoothly. I am not inclined to go down that path of text messages, unless, of course, there's a law passed that instructs us to do so. I think our legislators probably do the same thing, texting back and forth. I think additional information brought forward through text messaging is obvious. I will get information on my phone, policy, subject matter, for instance, and I readily make that available. I don't say this has come through by text. I will say it publicly as a point of additional information. I also have preserved those text messages, and I have not erased them as well. And I don't think that this is a problem. I think this is not something that we're going to be engaged in as far as text messaging is concerned. Now, Commissioner Savis, I don't see what you see in this, mainly probably because I'm busy running the meeting. And so if there is an issue out there that I'm not aware of that needs to be addressed, maybe that's for further discussion. But Stephen, thank you for bringing this forward. We'll make the necessary adjustments according to law to go forward. Please have staff make the adjustment in in my little preamble that I do. I have a very important meeting that's starting at 12:30 off campus. So any other comments on this? You guys can continue the discussion on this, and Gary, you can continue with the meeting.
Okay, we just have Commissioner Communications left.
Thank you
I just
very
want to,
much.
just one comment I want to make, that in these Zoom meetings, what's happening right now as far as the recordings of the meetings is that all chats and communications are recorded in the minutes. Okay? So that's a means of which people communicate with one another in the chats. It's also a means of which people communicate in the Q&A portion of the meetings. And also people are using text as well. So it's becoming an integral part of the meeting. So I strongly advise that we have some kind of a policy or recognition that those communications be included in the meeting minutes and made available upon request.
So oftentimes I'll get a text from a staff person saying, haven't you considered this? So that should all be public. I don't know, I never have anything on text that I'm worried about. In fact, everything on this phone is public record.
So Commissioner Savis, you're still the vice chair, so if you'd run the meeting at this point.
All right, what's next, Gary?
If I may, Stephen, in the law, does it reflect Zoom chats? Is that required to be retained?
That would be for the public records and archive retention. So yes, if it's created and it's part of the official meeting and it's able to be recorded and preserved, I would say yes. But that's not this law. This is just about access. It's not about the archiving and preservation of it. But yes, if it's recorded on Zoom, I would say all those chats should be recorded.
They're public. So what you're saying is if we're texting back and forth, like if Tracy texts me and said, well, there's this point, this point, this point, have you thought of that? That should be public record.
Well, I think if it pertains to the meeting, right, if it pertains to the meeting.
'Cause sometimes,
and most especially if it's to and from other decision makers, right? And it's calculating into there. I mean, that's, in a live meeting, in a live meeting, someone would pass the note over, or someone would say, put their hand up. You're the whole purpose of this is to give equal access, and equal access is equal access. And frankly, I'm actually thinking about, whether it's this legislative session or next, making that, incorporating that, frankly.
Okay.
Because I think it's to the point of abuse, I'll be honest with you.
Well, to your point, if they concern the government's business, a matter under consideration or deliberation, then they're a public record as a matter of current law. It's the preservation component which makes it a challenge. Like, that's your phone. Those are your text messages. They're not on our county email system. I can't retrieve them and produce them. So I understand your point.
Yeah, so you think you do think it's being abused? Because I'm pretty
I
careful.
believe it's ramped up like never before.
Yeah, because as I said, usually I'll get something from staff, but it's normally saying something to me like, what about this point? What about that point? Have you thought through it this way? So it helps me as a commissioner, but there's nothing there that I feel uncomfortable sharing. I mean, I could just say Tracy texted me and said, have I considered this? And I said, what? Because I find that helpful, but I'm not normally having text conversations with people. Unless Sonia asks me to shut my mic off because I'm sniffing too much.
It's been brought to our attention by constituents who watch our meetings and realize that we are texting, or there is texting taking place.
And they're concerned about it.
No, it's that if you're going through your emails, or they don't know what it is, so either emails or text, you're not paying attention to the meeting. I try to put my phone aside unless I'm looking up something like the NCPRD meeting, for example, not being posted today. Situations
Well,
like that.
maybe we should just have a policy for us as commissioners that we just don't, no phone. I'm okay with that, too. I mean, if I can't think of it all on my own, I guess that's my problem. But I have found it helpful with staff, that's all.
Yep.
But I'm not.
It's not there's anything wrong with it, it's just making it available.
Yeah. I'm pretty careful not to deliberate with anybody, no matter what medium it is. I just don't do that.
Commissioner Fisher has her hand raised.
So,
Commissioner Fisher.
Sorry, Commissioner Fisher, I outed you. I didn't mean to.
No, that's okay. Sorry, I have some work being done here. It's really loud. Our text messages, if anybody were to request them, are for public record. And I think it's very important to be able to communicate with staff during meetings. If anybody wanted to get access to them, they could do a public information request.
I understand. I think that's creates a difficulty for the public in general when they're not even aware of it. Whereas if it's in the record, it is, and I think it really, full disclosure, I think we have a responsibility to do it. And that's why I brought up the Zoom meetings, the chats, those are all being included because it is a communication, regardless of how trivial it may be or how informative it may be, it's included in the record. So I don't really see a difference other than the ownership, which is a challenge. But that's my opinion, and only my opinion. So anything else on this matter?
All right, not on this matter, no.
Okay.
Thank you.
Thank you, Stephen.
Yep.
Last item is Commissioner Communications.
Mr. Schrader. Congratulations.
Not on again. I forgot what it was like taking care of a 2-year-old. And as much as I enjoyed it, I'm ready to hand that over to the younger folks. So there you go.
Commissioner Fisher, what's your update? Do you have any?
Yeah, I'm trying to get connected to my AirPods so I can communicate. So go on to the next person and then come back to me, please.
She said to go, she asked to move on, come back to.
Okay, Commissioner Scholl.
Yes, good afternoon. I apologize for not getting back. My flight down here ran into some problems. One of them was the new mandate from Washington for the 24-hour COVID test. And on New Year's Day, guess what? There's no place to get one. So I will be back tomorrow by hook or by crook. Before we went on break, I attended the Association of Oregon and California Counties in Roseburg. That was on 17 December. It's a very interesting meeting. and I've got some information to report back to you. I think I'll wait till I get back to the office and make that report to you on Thursday. And since I didn't get to wish you all a Happy New Year, and I'll see you tomorrow.
Great. Thank you, Commissioner. Commissioner Fisher, are you back? Or
Yeah, hey, sorry about that. That's some really loud sounds. I don't know if that's interfering with my communications. Can you guys hear me okay?
Barely. You're breaking up from time to time.
Oh, okay. Well, I am interested. I've been working with Gary over the break and over the last few weeks in figuring out what the policy is and what happens when employees are suspended or on leave, and what our requirements are and why they are the way they are as far as who gets paid when they're on leave or who doesn't get paid, and brought in light when we had the employee who resigned actually, but an investigation started with the swastika on our campus. Did not become an issue, but I became aware that employee would have been paid per an administrative leave. And in talking with Gary, that is part of our county code. And I'd be interested to know if any other commissioner would join me in asking for a recommendation from our staff in changing that. I know that Gary has some ideas. He has communicated to me that he thought that it should be changed, and that we should proceed with that as a matter of business to move forward with.
Well, I would say I would certainly be interested in learning more, having a work session, and see how that factors into the state law, which requires something similar to that, as I understand it. So I think our county code I'm assuming that our county code attempted to incorporate the state law requirements and embed those into our county code. So I don't think we can violate state law, but if there's a work session that will inform us and the public to a greater level on this, I would, definitely support having an informative work session at the minimum.
Why don't we come back to the board on what all your options are? The biggest issue is the entire county personnel guidelines are in the county code, which they shouldn't be, in my opinion. That's more of an administrative function that you would give to the county administrator. So the first step is to take it entirely out of the code, I recommend. And then second, this item about when an employee is put on administrative leave, they have a right, both a state law and through our county code, that they're paid until it's determined if they have to face discipline or termination. So yes, there were employees that have been paid for quite a long time while an investigatory matter was under review. But anyway, let us bring it back to you, commissioners. Maybe we'll start at issues or a policy session, either way. Yes.
Yeah, great. Well, I don't have anything for today, so seeing nothing else, we are...
So Paul?
Yes.
I'm sorry, I wasn't finished. I just wanted to communicate that was one thing that I wanted to communicate. And then I'm also been tracking and am thinking that we need to be extra vigilant and careful as Omicron is increasing. It's going to go, I expect from all that we're hearing, it's going to run fast and furious, and then it will subside. Anything we can do to minimize the spread, I think, is important. I think as we get more information, that may change. But I want to just encourage us to do as much as we can remotely and to limit interactions. I don't know if anecdotally you're hearing what I'm hearing, but I know a lot of people who are pretty sick with COVID right now. And I am concerned about anything that we do as a governing body, not setting a good example to others and how we need to operate in these next few weeks. I'm concerned about that. And I'm also concerned about those among us as part of our team who are not vaccinated or fully vaccinated and are at more risk than those of us who have been vaccinated and boosted. And so I did communicate my concerns about the county commission having their executive session in person in the small conference room. I was not there today not because I am so concerned about myself, because I am vaccinated and boosted, but for members of our team who may not be fully vaccinated or vaccinated at all, I do not think our actions should put them at risk. And so that is my concern, and I'm stating that to all of you, I would hope that my other commissioners would join me in only meeting in person when absolutely necessary and just for this short time while Omicron is racing through. If it ends up that it's just a simple sniffles, then I would have a different view, but we just don't know enough. And what I'm hearing when people are sick, they are down for the count, and that hurts our ability to function as a group. If we all got sick, or if, it hurts us. So we need to protect each other as best as possible.
Well, thank you for sharing that, Commissioner Fisher. I'm certainly, everyone's got their eyes on this, and I feel that if the OHA or the CDC gives us guidance and makes some changes, and the governor makes changes to make things ultimately more restrictive, but to take greater precautions, then that may be warranted. I too had the same concerns, but it must not be that serious if the schools are still, in class. I watched the school buses go down my street this morning. So apparently, if it's really, really severe, I don't think that would happen, but I'll just wait for the state guidance. We have trying to abide by that as best as possible. I know that's our policy. And if if there's a chance to have a great discussion on whether or not we want to take greater precautions, I think we need some more information from our staff, and perhaps the OHA and the state as far as ramping those up. But otherwise,
hey, Paul, I just want to respond to that if that's okay. I do think it is I don't like mandates. I don't like requirements. I don't like the state telling people what to do. I think it creates a adversarial relationship between the people and the government. But I do think that we can set an example and we can take responsibility as ourselves without waiting for the governor or the CDC or anyone else. The guidance hasn't changed. In-person contact, breathing the same air is still how this virus transmits, and we know that. The guidance is there, and the guidance is strong, and we can follow the guidance. And that would be something I would just ask my other commissioners just to ponder and consider for the next few weeks.
Point taken. Anyone else have any comments? Okay, Commissioner Fisher, are you finished?
Yes, thank you, Vice Chair Savas.
Great. Thank you all. Any other business? Seeing none, we're adjourned.